Welcome, everybody. Give everyone a second to come on in and get your sound connected and join us. Wonderful. So hi again. My name is Kayla Fulginetti. I'm the Senior Director at Elephants&Tea, and I am so excited to welcome everyone to our next session of AYA Power. It feels like we were just here because for those of you that might be back again, we did have a session last week as well. And so we are hoping that you are joining again, or maybe this is your first time, but welcome. This is the Adolescent and Young Adult Program for Oncology Workforce Education and Resources. It is an amazing hub and library of experts in their field about what they do as it relates to taking care of adolescents and young adults with cancer. We are excited, really excited about our topic today. And so I won't take too much time, but just a little bit of housekeeping before we get started. I want to thank the sponsors of AYA Power, which is the I'm Not Done Yet Foundation and AZI. Thank you so much for supporting what we do and our abilities to provide this education to everyone. This is a webinar, and so you will see the Q&A button down at the bottom. We really love the discussion that we have at the end with our experts and with our speakers. So as you are thinking of questions and things come up, please make sure that you are dropping those in there so that we can really use the time of our expert here and kind of pick their brain and get the information that we're all really looking for in this space. Please also make sure that you check out our website. I will drop that in chat in just a minute, but we record all of our sessions, and so those all exist online on the AYO Power landing page so that you can access all of our content and look back at previous sessions, share those with others in your community and in your profession so that we can continue to kind of push out the education and knowledge to all of us that are just craving it and looking for it. So with that, I am excited to pass it off to Mike to introduce our speaker and get us started.
Great. Thanks so much, Kayla, and welcome everyone. Thank you guys for spending time with us. You guys are in for a real treat. This is a very special session, and I'm really glad that you guys are here with us. We spend so much time focused on caring for others and caring for our patients. Oftentimes, we don't stop and reflect on how that impacts our own health, our own needs, our own quality of life. I am thrilled to introduce our speaker today, who has a lot of expertise on how we can deal with those emotions, share those emotions, and also just acknowledge that we have those emotions. So it is a privilege to introduce Dr. Vinayak Venkataraman. He is a wonderful AYA oncologist at Dana-Farber. He specializes in sarcoma, which we all know is clearly an AYA diagnosis. If you want to read all about his impressive bio and the wonderful degrees that he has gotten over his lifetime, please go to his formal bio on the Dana-Farber website. Really, I just want to say it's been a privilege getting to know Vinayak and also just reading his work. I've learned a lot from him and his writings personally. And on that note, I will pass it over to Vinayak, and please put your questions in the chat and the Q&A. We're really looking forward to a wonderful session. Thank you so much, Vinayak, for joining us.
Awesome. Thanks so much for having me. Can you see my screen, Mike?
Perfectly.
Oh, great. Awesome. It's really an honor to be here and chat about a topic that's really near and dear to my heart, and that's the role of writing in our care of adolescents and young adults, as well as the care of ourselves. And as Mike mentioned, I'm right now in Boston at Dana-Farber and care for a lot of young adults facing sarcoma and other cancers. I don't have any disclosures. The first part of the talk, I just wanted to cover, why should we write, and if we decide to write, what should we write about? And then most of the time I wanted to spend in my second section, which is sort of sharing from my own experience in using writing throughout my practice from medical school to today as an early attending and what I've learned about caring for adolescents and young adults who face illness in 4 stories that I wrote over the years. Narrative medicine has been around for several decades. It was pioneered by many physician writers, such as Rita Sharon at Columbia. And really, the goal of narrative medicine is to allow us as physicians to better connect with our patients, to connect with ourselves, with other colleagues, and also with society as a whole. And really, the goal of narrative competence, or at least one of the goals, is to develop what's called narrative competence. And this is meant to be in tandem with scientific competence, which we all know we spend a lot of our lifetime as doctors or other health professionals developing. But narrative competence is different. It's really the ability to acknowledge and absorb the stories that are being told by our patients or unfolding in front of us clinically, to interpret the meaning and to honor the meaning of those stories, and then finally to respond to or be moved to act on our patient's behalf. This can be done through many different frameworks and lenses. One is close reading of narratives, either fiction or poetry or even memoirs. Another is through authentic discourse that we have periodically, sometimes between physician and patient, sometimes physician and other colleagues, or also with society. But what I'm going to speak the most about today is the role of reflective writing as part of this model. And reflective writing, just very simply, is when we have an experience that sort of gnaws at us or causes some concern. We can't get it off our minds. And then typically in retrospect, we explore it by thinking about the many facets of it. We might talk to others. We might, iteratively think about it. And through that process of exploration, we find meaning, and we change potentially our perspective, and then we share it with others in a way that develops shared empathy. We know within young adult or adolescent and young adult cancer care, our patients really, writing is very important to them, and all types of writing, be it memoir writing, such as The Beautiful Between Two Kingdoms by Sulika Jawad, or poetry, such as Letters from Max. Even in blockbuster creative lens like The Fault in Our Stars, Elephants and Teas, the beautiful essays that are published, or artworks that are published through Elephants and Tea, allow for creative expression of our adolescents and young adults as they face cancer or in their survivorship. And then also, some young physicians who face cancer at a young age who wrote about their experience and shared them with their colleagues. And so why write as oncologists or oncology professionals? And the reason is we witness some of life's deepest and darkest and most intimate moments. And these moments can move, inspire, frighten, teach, and challenge us. And we also know as we become professionals in our practice that, by acknowledging our emotions and really delving into the art of medicine and reflecting on the learnings and the feelings, it's really critical to us becoming better doctors. And more broadly, humans find meaning through stories, and we connect with each other through stories. And, just an important point that not everyone is necessarily interested in sharing their writing, but really our stories demand to be written. And, even if we don't publish them, there is a benefit to writing about them. Then the question comes, what should we write about? And, there's a tension as writers in healthcare, especially when writing about patients, of balancing freedom and consent. Freedom is the ability to do whatever we want or write about whatever we want. And then consent is, a lot of these involve patient stories, and there's privacy and sensitivity that we need to be cognizant of. And so it's important to ask when we want to write, why is it important for us to write about this, and what is my intent by writing? And then balancing that with how would my patient feel if they found and read what I wrote? And would I be able to hold my head up high in clinic the next morning if I published what I wrote? And there are no easy answers to this. And sometimes we are tempted to generalize or de-identify or fictionalize or embellish. But I've, recently through some pieces that I've published have learned that there is just a benefit to asking. And actually, by having that conversation with a patient who's inspired a piece and saying how they've inspired you to become a better physician, it really can be a very powerful avenue for further discussion and forging connection. Not everyone is into writing, but I would encourage everyone to be interested in reading it, at the very least, reflective writing. And really, it's through reading that we find common ground with the colleagues that we have never met, and reflections can be therapeutic for both the reader and the writer. And thankfully, a lot of our medical journals in cancer care, both for kids and adults, really value the role of narrative. And at our ASCO annual meeting, there's a really special session called ASCO Voices, where both patients and physicians are able to reflect and share. Okay, now we've decided that we want to write. What do we write about? And I still, go back to an essay that one of my writing mentors, Suzanne Coven, who's the writer in residence at MGH, had published in The Lancet in 2019 as a guide for fellow writers. And she starts her piece or her essay reflecting on an experience where her daughter and her were sitting outside the train station. Her daughter was about to leave to go back to her life. And as they were saying goodbye, a man who's intoxicated staggers and collapses in front of them. And Dr. Coven has to, as a doctor, rush out, make sure everything's okay, make sure the paramedic is called and knows what to do, and then is able to finally escape, say goodbye to her daughter quickly, and then drive away. And then in the process of driving away, something gnaws at her and a concern and the idea that there's a story there, but what's the story? And she proposes a framework of finding the story, starting to write, revise and revise and revise, and ultimately share. And so when we find the story, what makes for a great story? And it isn't an easy question to answer, but things to consider is it something that you feel like you have to tell? And oftentimes I'm compelled to write. I'm someone who writes maybe every 12 to 18 months. And I have to be compelled by some experience that's really either asks me a question that's not easy to answer or makes me uncomfortable or really particularly moves me. And that's really when I know that it's time to write and find that story. Starting to write is the hardest part of the journey. And a lot of it has to do with, being in medicine. We're so used to being perfect and needing to be perfect. And, for writing, we really have to abandon the meticulousness that medicine requires of us. We just need to get the words on the page, delve into that verbal chaos, and then, hope and through iterative thinking and reflecting that some structure or a glimmer of a story emerges. But we don't stop there. And I think a lot of people sometimes stop at that first draft. And really the process of revision is not just important to make it a better writing piece, but revising is really where the reflection process plays out and where we actually learn a lot about ourselves and why an experience was meaningful and what we really truly learned from it is. And often the most fruitful moments in that process are the unexpected ones, or they come down later in the process. Since we always want to be open and leave the door open to further possibilities and not feel finished with each draft. And then eventually we'll reach a point in a final revision where it really feels like this is the story that I want to tell, and this is how I want to tell it. And then when we reach that point, it is important to share. And I don't think I think there's a pressure or a stress that sharing needs to be a publication or a journal or a blog post. And oftentimes, sharing for me early on when I was just getting, started as a writer was just emailing it to some friends and family and colleagues and seeing what their response was. And I think the importance of sharing is really that empathy that can develop, and that a story that resonates with you will often resonate with others. And there's a shared powerful connection when you share it with someone and understand their feedback. And so she concludes this piece, wondering what is the story that she was trying to tell? Is it the idea that she was a good Samaritan and they're sort of like the challenges of being one? Was it facing alcohol use disorder or other social determinants of health and how that affects society? Was it, she always noted that every draft would be her going back to her daughter to say goodbye. And was it really about being a mom and sort of contrasting that with being a doctor? But finally, she realized that really the story was about writing. And so that's why she wrote this essay. And after she published this essay, I was a resident at the time at Mass General Hospital. And we together developed a resident writing workshop because we realized that a lot of other residents across the hospital were had seen so much as the first line in healthcare in our country. And this is around the time of COVID. And by using this framework model, we reviewed drafts, read brief readings, offered feedback, and some really powerful pieces came out of these workshops, some of them which were published in the lay press. So now I want to shift gears, and this is going to be a very personal and meaningful part of the talk for me, and it's really sharing some of the stories that I've written over the years, some of them published just sort of locally and others published more broadly. And by doing so, I just wanted to demonstrate, sort of in my own experience, how I've used writing and reflection to learn about how to better care for adolescents and young adults and reflect on that process. And my hope is to be a model for others to use writing in their own lives. I've always had an early passion for fiction, and so that really drove a lot of my interest in writing. And I don't have, truly formal education in writing or fine arts. I think the most was in college. I took a creative writing class, and through the process of that class, I wrote and ultimately self-published a novella, Coming Home. If you're very bored, and it's on Amazon Kindle. But medical school was the first time, where I was faced at a young part of my training and with like really sick patients and not knowing how really to process it in the moment and using writing as a way to reflect retrospectively and share my experience with others. And, one of the first pieces I wrote reflectively, but using the lens of fiction, was my first experience actually as a second year medical student at Duke on the pediatric hemonc service, when I got to know a really adorable 8-year-old who was admitted for aplastic anemia, but also had a severe fungal infection at the time. And, I just remember that first week I was getting to know him, that I was just struck by, even though he was gravely ill, he acted like he was a typical 8-year-old and shared with me a lot of his 8-year-old life. He really loved to play video games. And thankfully for pediatrics, as some of you know, there is a culture, especially as a medical student, of playing with your patients and that being a really important part of your life. And he'd always beat me, but it was fun to at least play. Towards the end of that first week, though, we got word from our infectious disease team that his infection was much more lethal than expected. And really, without recovering his bone marrow function, he was expected to pass away. And, though I wasn't his family, I was just really devastated when I heard the news. I'd been getting to know him every day for that week. But it wasn't like I knew them for too long. And so I did escape and I cleared my head and I talked with some advisors, and there was this temptation to sort of retreat and maybe become a little bit more distant. And they told me in that moment that the times they most regretted it was when they allowed bad news to make them retreat. And so armed with that advice, after finishing up for the day, I did go back and spend time with his older preteen brother while the attending and fellow delivered the bad news. And um, uh, overall, like those few hours really, even, this is about a decade ago, those few hours were probably the most powerful in my life when I really resolved to genuinely care for a family I'd only just met a few days before. And really over the next 2 weeks, as I was on this service, I got to know him more and more and play with him. And, it affected me really strongly emotionally. I'm not a big crier. It's a lot of people I know me know. I cried more in those 10 days than the past 10 years. And, I felt like I was part of the family, but I knew I was not. And on my last day, they gave a really kind gift that I still have in my office, a picture of them in Florida and a really kind message. And this is me reflecting as, 10 years ago as like a second year medical student, but I was still trying to find meaning, even though I was pretty inexperienced in healthcare. And, at that time, I just realized that it really wasn't about how long he had left, it was more the quality of time he had left. And also realizing, and I think this is something I still think about today, is that, we sometimes put emotions or imagine emotions in our patients as sort of transference. But in his mind, he wasn't getting down about how he might not drive or go to college. Those are emotions I was feeling because I was older and sort of had a better appreciation for the things he was going to miss. And his family was feeling that way as well. But he really just wanted to be a kid, and he really wanted to just beat me in Mario Kart. And so it was tough to see him get sicker every day, but he did try to keep that childhood spirit in him. His story continued. Next couple of weeks, he was not doing well. He was in the bone marrow transplant unit. They were supporting his body with maternal blood cell transfusions from his mom. Eventually, they were able to get a bone marrow transplant, but during that process, he was just becoming so weak and tired. And I realized at that time I was on other rotations, and I was just becoming too emotionally invested, really to the point where my mood was really becoming determined by his clinical state. And it's at that point I really realized that I needed to step back and take some distance. And so like a couple weeks later, I was able to re-engage, but I felt in a better place because I had taken that time. Thankfully, his story has had a positive ending at the time. He got a bone marrow transplant. He cleared his infection. He went back to his life. I'm still in touch with his family, and he's graduating high school this year, and he's like a state wrestling champion in North Carolina. I didn't really have any specific major takeaways. It was the first time I'd written reflectively, just that it was really emotional, and I was really like so happy that people around me connected and supported me, and it was really just a joy to connect with his family. And now reflecting back like a decade later, realizing that becoming close and feeling a part of a family is nice, but it does come with physical and emotional costs. And then I do wonder, like as a medical student, I had more time at my disposal, but I still was on other rotations. And am I neglecting other patients by becoming so invested in one specific one? So I still think about that today. And how would the story have changed, if he hadn't gotten better? And sort of thankfully we don't have to answer that question, but it could have like affected me and changed maybe I might have gone to a different profession. I don't know. So the second story is from 2 years later. So I'm a fourth year medical student. I decided I wanted to do med peds residency. I was applying for residency, and I knew I loved taking care of young adults facing illness, and I wanted to be in that in-between age. And I took care of in the pediatric ICU as a sub-intern, which for those not in healthcare, in your fourth year of medical school, you would often take these roles akin to an intern or a first year resident on the team. And so I was in the pediatric ICU, and a 10-year-old had come in, and he was very sick, and he needed eventually, like very quickly, to be intubated for his own airway protection. And I realized in reflecting on how I handled that second situation versus the first, it helped me through writing to appreciate the growth that I had gone through, and allowed me to sort of reflect on things like resiliency and burnout. But just briefly, is the second kid? He's a adorable 10-year-old. He was sort of your typical adventurous, fun-loving Southern boy, and thankfully, with again like very aggressive treatments, plasma exchange, IVIG, 2 weeks in the ICU, he was able to finally achieve some neurologic recovery, and then 2 weeks later, he was able to walk and go to rehab, and so his journey was a little bit shorter, but still a lot of uncertainty during that time for his family. And due to the similarities of both of these experiences, I just sort of thought in my head, you're going to get emotionally attached. These are your Achilles heel cases, like these previously healthy, now severely ill patients. Sounds a lot like taking care of young adults. So I guess I've continued it. But they really are the ones that send you into a tailspin. And so it was interesting to me that I handled it with a lot more emotional maturity than I had expected, and had handled the first one. And reflecting on that sort of growth allowed me to reflect on why I think that was. And, part of it was during the first experience, at that time, I had consulted a palliative care physician, and he told me that his guiding principle, which I use today also, is, it's the patient's moment. Be present, they'll tell you what they need. And at the time, I had interpreted presence to be physical presence and really being presence at bedside, but I realized that that was too narrow. And, really those hours of spending time with observing the juxtaposition of playfulness and severe illness, it really created that environment for me to become emotionally overinvested. And I realized with B, especially because I didn't have as much time to be as physically present, I could still be engaged and actively involved, but I didn't have to be physically present. My presence could still be felt. The second was balance. In the first situation, I really had trouble checking out. I kept work at home. I took work home. Even when I was out with friends, I was thinking about him. I sort of thought if I tried to establish emotional distance, it felt like selfish. I was ignoring his plight. But then I realized, self-care is not selfish. In fact, it's selfish to not come to work refreshed and ready to tackle every patient's challenge. And really, there's no dichotomy between emotionally investing really strongly at work, but then also finding ways to leave work at work and invest in self-care at home. Third, the first experience was my first inpatient rotation. And so providing support was all I felt I was competent to do. And, thankfully, medical school, you learn a lot. And so I felt a lot more confident in my second time around, and really curiosity became a useful avenue for me to invest that emotional energy and also show his family how much I cared. And then finally, I think importantly, one reason I was so motivated to have pediatrics as part of my training was I noticed this unified passion from everyone, from janitor to attending physician, to save each kid's life. And really measured hope does, with, despite the clinical setbacks, is reasonable. But I think it's important to have perspective in that, though we can never dictate the ends, we can always control our approach to the means. We can derive satisfaction and pride from providing compassionate, wholesome care and advocacy, but at the same time, maintain humility and understanding that we play a single role in a larger human drama without a script in hand. And so more generally, I realized through reflecting on these two experiences and the growth was, being present doesn't mean being physically present. Self-care isn't selfish. Keeping work at work is challenging but necessary. Having more knowledge can be protective, but also challenges hope and optimism. And then finally, and I still try to use this today, we do the best we can with the information we know and the tools we have available to us at the time. So the third story comes from residency. And so as a med-peds resident, I matched to Mass General Hospital and spent my time there, half in internal medicine training and half in pediatrics training. And so a lot of my stories and experiences came from both sides. And I wrote a few pieces along the way, and this is one that I wanted to share. And this was a unique experience because I was able to write it in the moment in my second year residency, and then later was able to reflect back on it, 7 or 8 years later as an attending and being published in this collection of works, Becoming a Better Physician. And so it started my second year of residency and was a patient who was severely ill. He was in his 20s, but had severe heart failure and required very strong medications to keep him alive. And he was a difficult patient. He pushed everyone away, the nurses, even myself. But at the heart, I just saw a kid who grew up healthy, became fatally ill, and was just like scared to death of what it meant. And, I really wanted to get to know him and learn about his tortured life. And, I just felt this strange desire to just get to know him better each day. And I see the judgments that have been smothered him his whole life and try to wipe a bit off each day. Unfortunately, he was really sick, and the only way for him to really safely leave the hospital would have been to get a heart transplant or a ventricular assist device. And we were the fourth hospital he had been to in the area, and similar to those, due to some social and behavioral reasons, he wasn't going to be offered one. And I, at the time, I was just like, I'd become close to him. Just we were both from upstate. We both loved music and football. And so I volunteered to be the one to tell him the news. And I reflected on one of my friends, Victoria. She's a sarcoma med peds doctor in University of Michigan. She had written a piece about the role of sports and how it helps us to connect with patients. And I've realized over my entire career, including today, really football has been the easiest way to connect with people. I'm a tortured Bills fan. But then also become close, you're building rapport, but you can also become too close in that process. And so that's what I sort of realized as I was rereading this piece. But I remember really vividly the moment when I delivered the news to him. I didn't really even have to say much. It was just sort of body language. And he knew that he wasn't going to get the care that he needed to live. And I just walked out of the room. I was just so devastated, and the outrage that the life that he had been dealt, and wishing I could prescribe love and support so he could get the care he needed. And really, as a young trainee, I was really mad also because there was nothing I could really do. A lot of the decisions were well above my head. Thankfully, I had a nice senior resident who allowed me to escape for a little bit, and I did have to temper some of my idealistic rage even in that moment. A lot of our patients had ventricular assist devices and were being consumed by strokes and infections. And so I was reminded also that a lot can go wrong when we push the bounds of medicine. And so I went out, I buried my head in my hands and cried, and had a few, just because medical training is unforgiving. A few minutes later, had to go complete the next 12 hours of my 24-hour shift. And during that time, that same night, and then for the days ongoing, we would sit together as he processed and grieved. And, he had been thinking about his death for quite some time. And, he had thought he was a bad person, and he met a really lovely girlfriend who changed his life and made him feel like he could be better, and he was trying to be better each day. And he really loved his girlfriend's younger daughter, and he wanted to walk her down the aisle so badly, and he had already picked out a song for her. And then just like a profound amount of sadness, realizing that would never happen. Then we sort of talked about special places for him, and he loved being out in nature. He loved his dad's old house in upstate, and he really wanted to go back home one last time. And I think he just wanted to tell me that about the dreams he had that he'd never accomplished. Just he wanted me to know that he was having dreams, and we really tried as a team to make his final dream come true and get him home one last time. One of the pinnacle moments of my life, and I still remember this day vividly, is July 4th. I was on call, and he really wanted to go out and see the fireworks, and he was a few days from being discharged. Thankfully, we were able to come down on some of his medicines, and the cardiac ICU nurses at MGH are incredible, and they found a way to get him into a wheelchair and get his tubes hooked up to him so I could take him down with his nurse to watch the fireworks. And this is a picture from Suro Ave outside of Mass General Hospital that night. And it's really just amazing to see how much he lit up and just being free and unleashed. He loved fireworks. And, we watched together as colored flames thundered up from the Charles River into the white dotted sky, explode into red, orange, and purple stars and rain down over us both. And then a few days later, he was able to be discharged. He made it back home. He reconnected with his family. He had 3 last wishes: a motorbike parade, a wedding, and a pig roast reception. He got all 3 of those. It was covered on local TV. And then he was able to be a father and a stepfather, or husband and a stepfather, for a few days until he passed away, and comfortably at peace and amidst loved ones with dignity and beauty. And so, as I mentioned, I was able to reflect back on this story 6 years later, and I still remember it so vividly. But there was a good element of distance, which allowed me to process it in a different way, and also realizing I was in my mid to late 20s as a resident, and now I'm a little bit older, and so I'm not as age matched with a lot of the patients I care for, and so I, rather than assuming connection, I forge it through just being compassionate and curious and listening to what they need. And then as attending now, I was really angry at the time, but I can see sort of the decisions that were made through the lens as an attending. The decisions they made were hard and gray, and really easy decisions, like offering certain life-sustaining therapies, can cause undue harm. And it's something I have to consider as a medical oncologist now of, is chemotherapy going to do more harm than good? And so ultimately I'm proud that of the resident that I was, who stood up and supported a young patient I grew to deeply care for. But I'm also proud to be an attending now who strives every day to provide the very best care to all of my patients, but who also works hard to establish balance, boundaries, expectations, and practice. And the final piece I wanted to share was for my first year as a medical oncologist, written about a year ago. And this one I was fortunate to have published in JAMA as a piece of my mind called Setting Intentions. And in this case, this was a specific patient, but it also represented a lot of other patients I'd cared for, and really reflecting on that first visit when sharing diagnosis and treatment plan. And so it was someone in his 20s. He had to move back home to a childhood home for a new cancer diagnosis. Again, a lot of connection, chatting about sports and life, and pretty somewhat age matched. And just he had metastatic cancer, and so he really needed to start treatment. And I just remember in that moment just being so afraid to say the wrong things. And I've had difficult conversations before, but only as a fellow, and it's just much easier as a fellow because I knew that I could say whatever, and it really wasn't my patient; it was the attending's patients. But now I'm the attending, and I can't step away. And I remember hedging several times, discussing uncertainty. His cancer is widespread and aggressive. The treatments we would offer would be very intense. I wish I knew how things would play out, but we had to take things one step at a time. But what really sort of irked me and made me really question things was in our chemotherapy consent forms, we have to specify what the goal of our treatment is. Is it to cure someone, or is it to improve someone's quality of life and control the disease, or palliative? And previously, as a fellow, I'd filled this form out for other adult patients, and But now as a new oncology attending, caring for a young patient with metastatic or stage 4 cancer, but one that's more commonly seen in kids, the same prompt caused me a lot of intense worry and anxiety. What was my intention in starting treatment? Is it my intention what I think will happen or what I hope will happen? And what sort of challenged me in the moment was he was a young adult. He was not a kid, but he wasn't an adult. He was somewhere in between. He was closer to middle school than middle age, but he was mature, resourceful, and determined. Also, some of it was my own beliefs and expectations. I was, as mentioned, a med peds resident. I trained in both to be a pediatrician and an internist. And though I'm an adult oncologist now, I almost became a pediatric one. And they both have different models of care. If he was an older adult, I'd really have no hesitation. I would check palliative, where we've gotten in medical oncology training, we get a lot of training in communication, and we're sort of taught to say there's no medicine that can clear your body of your cancer. Our goal is to help you live as long and as well as you can. However, his chance of having cancer disappear and never coming back, it was low, but it felt different. It was, 1 in 15 will live past 5 years. And his body could withstand treatments that were developed for children and ones that he could probably tolerate more than older adults could. So there was hope. And I vividly remember both in residency and in medical school, and you were caring for children with cancer similar to his, who I didn't think would live past the week. But some of those same children are going to prom and graduating high school, and their lives are changed, but they're alive. And I wondered if their oncologist had not set their intention as cure and done everything possible to achieve that elusive goal, would they be alive today? I don't know. And I also feared, but I also feared setting unrealistic expectations that could cause or lead harm, not allowing him to appreciate the wins, like getting better and doing the things that he loved because he had not achieved the ultimate goal. But even worse, that he would blame himself for not doing enough. I worried about setting my intention as palliative. I worried that this could lead to care decisions and actions that would forgo the chance of cure entirely. I worried that treatments would get delayed or deferred. And then finally, I was really just most worried that I would rob him of the hope he needed to keep going and push forward. And I really worried that I would take away from him everything he had dreamed of doing, of being, without knowing for sure how things would turn up. And so ultimately, I wrote Cure, and then I proposed to the audience or the reader what they would do. So just to summarize, I think writing is an important tool that allows us to reflect, to grow, to share really powerful experiences with others. The process of sharing and reading and discussion allows us to forge connection and collective empathy through writing. And I think writing, especially in our clinical practice, can help us to learn from our patients' experiences, from our own experiences caring for patients, especially AYAs who are facing illness. So with that, I'll say thanks, and I will stop sharing my screen.
Well, almost need to pause a little bit just to take it all in, Vinayak. Thank you for sharing those experiences. Thanks for sharing how you cope with and deal with some of the challenges that we all face on a daily basis. I do want the audience to please consider placing comments or questions in the Q&A or the chat. I have a few things on my mind, but Scott, maybe I could pass it to you if you want to open things up a little bit, maybe with a reflection or a question for Vinayak.
I'm still processing, I'm thinking. And I feel like probably if we were all in a room now would be a good time for everyone to like take out a pad of paper and write. I guess for me, recognizing the power of writing and how it helps, but not being much of a writer myself, also recognizing, I guess, other forms of the humanities as well, in terms of their forms of expression and trying to get that out and say and similarly. So that's where I usually go, is more of kind of the theater and visual arts person personally. But recognizing, yeah, that there's more that we could do, and the beauty of writing and the power of it.
Vinayak, there's a few comments and questions that the both. All the comments are saying thank you, and that was really outstanding and beautiful, and just appreciative of your willingness to share. I really love Fatima's comment about your kind of modeling bravery and willingness to be vulnerable. I had those same thoughts as well of the strength you have to share your emotions publicly. I think some of us don't share our emotions well personally, and we sort of hide them in a closet. But your willingness to allow others to see some of the pain and reflections that you've gone through is just really impactful. Going to the Q&A, one of the questions is, when do you think is the best time to write about these experiences? Do you jot initial notes down at the moment? Do you come back to it later? Do you do it all in one sitting? Or is this really just up to, whoever that individual is and when they think it's right?
Yeah, I think it's probably more based on the individual. I can only speak to myself. I will reflect in the moment. Some people really benefit from jotting it down in the moment and sort of thinking about it over time. I think for me, it stews in my mind for a time, and then I just reach a boiling point where I have to start writing, and I would just sort of like get it down on pen and paper. That can take for me, to be honest, like 6 to 9 months of thinking about something. And even for the stories I shared, it took probably 6 to 9 months before I actually went from the initial experience to writing. But I think for other people, it's different, and it can be helpful. Also, like some people like to have almost like pen pals and sort of sharing brief snippets. I used to, write sort of emails that I would share with my friends and family, summarizing the past month, for example, and some of the experience that I had. So that's like another way to think about sharing, because some of mine I shared, or like I published more broadly, but I think just the process of writing and sharing, that's like what's most important. It doesn't have to be in a journal. It doesn't have to be published publicly. It can just be amongst family, friends, and colleagues, and that can be really meaningful.
Thank you.
Along sort of, there are a few questions about your practice. So, whether you started to say this in terms of writing every day or in spurts. I guess another question would be, pen and paper you mentioned as opposed to dictating or typing, and if you have thoughts on that or what you would
Yeah.
recommend for people getting started.
So I didn't talk about this type of writing in particular, and I think some of the questions are about patient writing, and there are like different forms of writing than reflective writing. One is called expressive writing, and so expressive writing is sort of where you reflect on a very meaningful and traumatic or powerful experience, and you write in very strong detail, pen and paper, about that experience, and then you write a second 5 or 10 minutes about what are the emotions that you felt by writing about that experience, and sort of that connection between detailing the experience and the emotion, specifically pen and paper, so not typed, can be very powerful and meaningful. And so I think there is like something to be said about pen and paper writing, in that it really connects you. You're away from technology, you're away from others. And sometimes when you're first starting, it can be really helpful. And also if one's looking for that sort of therapeutic angle for writing, I think pen and paper does offer probably a better model for that. But I think for others, like sometimes people just want to audio record like voice memos over time, and that can be really helpful. Other people want to just jot down emails and send it to themselves or to others, and that can be helpful. So I think modality could be really dependent on the person.
There's a lot of comments and questions coming in. Drew, I want to acknowledge your comment about where can we find Vinayak's writings. We're going to post some of them on the AYA Power website and provide some links as well. For those, since you mentioned football recently, ideally a wide receiver on a good football team might be reading one of Vinayak's writings on the sideline, and it might propel his book up to number 1 or 2. But we will be sure to share with you guys some of his writings if we get permission to do so. A question for you, Vinayak, about sharing with the patient and or their family. Is that something you ever do? And then I'll note a comment by Dr. Blyer, who was a MedPeds resident just a couple of years ago, and noting the power of discussion and maybe sharing your thoughts and reflections with others, and whether you do that as well to address kind of inner, I don't want to say turmoil, but concerns about burnout and prevention of burnout just by sharing those emotions.
Yeah, no, the question about sharing is a really great one because I think it points to a really a tension that a lot of writers feel in terms of how to share and how broadly to share. Initially, when I was first as a medical student writing, I preferred the route of de-identification and also not publicly, like publishing it in like very small ones that wouldn't be as widely disseminated. For that reason, I just like felt very uncomfortable or self-conscious about sharing. Um, and then, but over time, both for ones that I've tried to publish or ones that I've published, I realized the value of sharing, and sometimes it's not necessarily that they want to read it, but just giving the opportunity if they want to read it. And actually, for JAMA, you're required. Like it doesn't matter how much you de-identify, you do have to get patient consent to at least let them know that you're publishing something that's based on their story. And I was actually, when it was initially preliminarily accepted, I hadn't done that, and I was really sort of worried about that. And that's when I realized that it actually was a very powerful and meaningful experience to share with a young patient that I had written something about how they impacted me and my practice. And I did offer him the chance to read it. The consent doesn't require that they have to read it. It just means that they had the opportunity to. And I think in his where he was in his treatment journey, he also realized that it probably wasn't the best time to read it in that moment, but he definitely wanted to read it later. And so I'll have to follow up with him if he's had a chance. But great question.
There's also questions about if you've talked to your own patients about writing and for them to use it for themselves, and I guess empowering patients to use narrative medicine.
Yeah, I know. I tried to, whatever like a creative expression resonates with people, I encourage them to 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 sh to either write or share if they sort of choose. Um, I'd say I think it's sort of there are like sort of like debates about the therapeutic benefit of writing and how to do it in a like sort of like the way you write can be important in terms of if you're trying to get therapeutic writing. But I think just creative expression is so important. And so regardless of whether it's therapeutic or not, I think it's important to and encourage people if they are so interested to use writing or drawing or art or video media to share their story. And I think that's evidenced by Elephants and Tea and all the amazing pieces that people have felt compelled to contribute.
What's that? I guess my own question, what's that conversation like? And do you have that conversation with all your patients? Certain ones you think might benefit more, or you find that they're struggling?
Um, Yeah, it's usually I try in the first encounter to take a pretty detailed social history and sort of understand like what their passions and joys and what brings them joy. So it's more about aligning with that. Um, sometimes they'll meet with all my patients, especially young adults, will meet with our social worker, Caitlin, and so she'll explore in more detail some of the more therapeutic benefits of writing and creative expression. But for me, it's more about like sort of giving them an outlet that potentially they could share their experience with others through a creative lens if that's something that they're interested in. I don't necessarily, unless like they want to try something, and just because I think people have different sort of approaches and interest in creative expression.
I'll add my own question as well as, some of us use humor to try to deal with some discomfort and not have to deal perhaps with some real feelings. What's your thoughts on incorporating humor into some of this writing? Could it work? Is it sort of not the right thing to do? And is there worry about it coming across not in the way you would hope?
No, I think humor, like dark humor, is sort of I guess technically a mature defense mechanism, right? So that's what we were taught in medical school. But no, I think humor can be really powerful. It's like on a day-to-day basis, we know that humor is a powerful method of connection and communication, and we use it in our daily practice. To your point, I mean, obviously, sarcasm and sort of when you're sharing it broadly, there can be a concern. So I guess I think just like having other people read it and see what their impression is could be enough of a test to for safety, but I think humor could be really powerful in writing.
Yeah, and to be clear, I'm just talking about a friend, perhaps Scott, who uses humor to deal with it. Of course, this isn't personal. There's another question in the Q&A. So you've gotten a lot of shout outs for your MedPeds background, and I will say as well, I always love when our AYE providers are trained in MedPeds. I think it gives you a different perspective as well as level of expertise. The question is about maintaining compassion and empathy. And we come in as a med student or a young trainee in social work, psychology, whatever field, and you're drawn to this field because you just want to help and support. And then life happens and training happens and you have these experiences. How do you maintain that compassion without burning out, and how do you make sure that you kind of maintain your sense of self while you're caring for patients, many who have poor prognoses and outcomes?
Yeah, I know it's welcome you, Mike and Scott, also to contribute. But I'd say in terms of like the focus of the talk on writing, I've actually found sharing writing with other mentors and colleagues has been a really powerful exchange, especially earlier on in my, when I was writing as a med student and as an early resident, sharing them with some of my fellows and attendings, and seeing what their responses were and what they've learned through their careers, like what about the piece connected with them and what could they share based on their experience. It's sort of like the next step for me. It actually helped to prepare me for the next step because, they approach it both in putting their mindset as a medical student and as a resident, but also how they've incorporated a lot of those tenets into their practice now. And sometimes those conversations, you'd expect them to happen, but they really don't. Like so much of your day-to-day when you're working with a fellow and a resident is so focused on here's the patient, here's what we need to do, here's the tasks. And so you don't always have space within your normal clinical environment to have those conversations. And so writing for me was a way to connect with both colleagues and mentors in a different way that was very powerful and allowed me to see like sort of how they were balancing and understanding these questions in their career. And sort of when I got to that stage, I at least had like maybe a leg up in some way of, or at least knowing what to expect.
Yeah, I would just really appreciate you commenting on creating the space to be able to reflect and provide time. I think many of us are hypocritical in that we ask our patients to create time and space to just be proud of themselves and think of all that they're going through and what they've accomplished and achieved. And we don't necessarily do that for ourselves as caregivers and providers. So I really appreciate that reflection. Scott, there's been a lot of comments in the chat. Anything else you'd like to address?
Well, just there are many people who are thanking you once again, and both in terms of today, but then others who have been on the receiving end of your emails and how much it has helped them. So thank you for what you do. There was a question though, in addition to medical journals, to have recommendations of where else people can look to publish their writing, maybe some other creative or out of the box locations to submit.
Yeah, I'd agree. I think if you're interested in publishing, knowing what audience you want to reach is first, that's important. So, I primarily write for other people in healthcare. And so the journals or publications that I look for tend to be more like academic journals like JAMA. JAMA has a section, A Piece of My Mind. NEDGEM has a section, Perspective. Annals has a section on doctoring. So those are very much like if your piece, you feel like the audience that is best that you're sort of focused on is in the healthcare sphere. Those are like the three big ones. And then each like subjournal, like JAMA Oncology and the Journal of Clinical Oncology have sections, The Art of Oncology. Pediatric Blood and Cancer has a section for narratives. So if you're looking for if your audience is not just like the general practitioner, but maybe focused in your disease group or whatever area you specialize in, you could look for those more specialized journals. If you're interested in education, like if you want to write about how you're impacting education, I think the Journal of GME has a on teaching section as well. If you're hoping to reach a larger audience, then sometimes just reaching out proactively to the editor of whatever journal or publication and doing like an inquiry of like, here's something I'm thinking about publishing. Is it something that you'd be interested in publishing can be helpful. You don't always get a response from them, but just cold emailing sometimes is the best option. Some people publish through Twitter. They create a Substack or they create a blog. Like that's also a form of publishing. And so if you want to just reach a broad audience in that way, that's great. If you're like if you don't want to write but you're creative and you want to do like TikTok for however long it lasts, or other modalities like that are also great publication tools. Yeah, so I think just generally like knowing your audience first and like who do you want to reach, and then finding the publication that best matches that is probably the best approach. And then if it's one where you're able to find the email of an editor or someone affiliated with that journal, it can be helpful to do an inquiry.
Yeah, that's
Also, I guess one
Go ahead.
more thing that you made me think of. For people who are interested in getting started, are there sort of writing groups for people, the way that, there might be grant writing groups and you can kind of spitball ideas? Do those exist for those in narrative medicine?
I don't know if they're broad ones. I've certainly myself, like locally, have organized ones, and I know within different health systems, there probably are, at least one or two people within the health system that are interested in narrative writing. Some people, if you're like really, really inclined to writing and it's something that you want to invest and this is something I'm thinking about, is there are low residency MFA programs where you don't necessarily have to go to a campus and take leave. It sort of allows you to do that at home and only go to their campus like 1 or 2 times a year. So those are options depending on like sort of where you are in that process.
We are at
Kayla maybe has some other ideas for Elephants&Tea, I think, hosting some stuff. So
Yeah, we're at the end of our hour, and we're going to pass it over to Kayla. This has been a wonderful session. It's been a wonderful discussion. I think there are many more opportunities to engage, many more opportunities to share your writing. I am suggesting to Kayla and Nick of Elephants of Tea and Tea that we have an entire issue dedicated to haikus from providers. So please, you'll see that in the next month or so. Just send directly to Nick at Elephants&Tea. But in all seriousness, just want to thank you, Vinayak. This has been a wonderful session. I think we've all learned a lot. It's given us time to just reflect and hopefully create more space to be able to reflect even more. So on that note, I will hand it back over to Kayla, who will be leading the haiku edition. And Kayla, if you want to close us out.
Yes. Oh, that would be amazing. Vinayak, thank you so much, truly, from all of us on the Power team and everyone that was here and able to listen to you and connect with your stories. I thank you, as many were saying, also just for your vulnerability and in sharing. It is not a place that we usually step into as providers. And so I feel like my cup has been filled the past hour and allowed me to reflect on things as well. And I know from the feedback that we're seeing that it has been really meaningful for others. So thank you for that. I am going to drop into the chat the link to the survey for this session. We truly do value the feedback that we receive, as it allows us to see what's really resonating with the community that is listening here and start thinking about topics and where else we kind of need to dive in a little bit deeper. I will also make a plug that Elephants&Tea does do healing through writing workshops for healthcare providers. So if you are part of a team at your institution that would like us to come in and do a free writing workshop with your team of providers, they are beautiful 90-minute sessions where we provide prompts and just guide people through processing and using writing as a potential therapeutic tool for people. And they have been one of my favorite things as a fellow clinician to sit in the space. So with that, this is the end of this session here. I will have information. Our next session coming up is with Susan Parsons next month. Please make sure you subscribe to our emails. Having attended this, you will get further emails about our upcoming sessions. but we will make sure to get the date and description out to you and the registration link for that as well. But again, thank you, Vinayak, thank you, Mike and Scott, for a beautiful and amazing discussion, and everybody for being here as you go back to the rest of your day. So thank you all so much.
Thanks so much.
Hi, everyone.